Well, thank you guys. Your competitors that you can beat is LASIX, because I know my patients are tired of peeing over that in a slide. So thank you to the biz. So let's get into it. Raise a hand, anybody relate? All right. Pink eye, sore throat, a rash, a minor injury, a sick child. I think we can all relate. I know one patient in particular who can relate. For the sake of this story, we'll call her Mrs. Migraine. Mrs. Migraine wakes up 7 a.m. Monday morning. She got a busy week of work. She got to start with a presentation, actually, Monday morning. So Mrs. Migraine starts to feel this headache coming on. She knows this headache very well. She's had it many times before. She knows exactly what it is. The problem is Mrs. Migraine hasn't been to her doctor in a little bit. She doesn't have any medication. What are Mrs. Migraine's options right now in our current healthcare environment? So Mrs. Migraine, she knows if she doesn't get this treated relatively quickly, she's going to end up in the ER, because this is going to turn into an intractable migraine. She's going to need IV medication. She's going to be there all day, spend thousands of dollars. What if she goes to urgent care? She could, but she doesn't like going to urgent care. She's not sure which one is open right now. Will she be late to work? She might have to sit next to a whole bunch of loud, screaming, coughing people with her headache. And then she's still got to pay her deductibles and copays. That's not a great option for Mrs. Migraine either. Again, she has a doctor, but again, 7 a.m. in the morning, doctor's not going to get back to her in time. It's going to be too late. What if Mrs. Migraine just says, forget it, the healthcare system has failed me. I'm going to go back to bed, call in the work, pull my head over my covers, call it a day. But imagine if Mrs. Migraine had a different option. Imagine if Mrs. Migraine could click on an app or just dial a phone and within 15 minutes be connected to a local, caring, emergency and telemedicine expert. Imagine if she had 24/7 access to this care. Imagine if using everyday simple technology like phone, video, and text, she could get a diagnosis within minutes. She could have a prescription sent directly to her pharmacy. And on her way to work, she could pick it up, already be starting to feel better by the time she sits down at 9 a.m. for her busy week. Imagine if Mrs. Migraine was so happy that the first thing she did was write a personal note to her CEO and HR director, thanking them for providing this amazing service, quality and cost-saving care. Quality and cost-saving care. Well, imagine no more, because Mrs. Migraine is one of thousands of members across the capital region who already experienced this with Upstate Concierge Medicine. So, problem-solution stuff. What's the big problem? There's a lot of problems, but a massive physician shortage leading to decreased access, and then healthcare costs spiraling out of control are two of the biggest problems in healthcare today. And Upstate Concierge Medicine can help solve those. Well, I got this slide in here, and it makes me think of Mike, this great presentation. But I don't do this to be controversial, I just do it to stir thought. So one of the huge, as Mike pointed out, billions of dollars, including hundreds of millions of dollars you may read about in our own papers, going into big data and technology. And that is a worthy goal. If we can connect all our systems together, that would help me. That would help my providers. That would help us with our patients. But would it fix all that ails healthcare? If tomorrow, snap your fingers, go to a happy place, and imagine tomorrow all of Mike's dreams came true, and everything was interconnected. Every piece of data, heart rate, blood pressure, glucoses, from Buffalo like Jimmy down to New York State, if it could just be solved, would that fix all that ails healthcare? How would that have helped Mrs. Migraine in this situation? Now, snap your fingers again, go to another happy place, and imagine everybody had what Mrs. Migraine had. Imagine if everybody had 24/7, 365 access to a local caring telemedicine expert who could help keep things simple, treat them when the things are easy and simple, and when things are not simple, exercise judgment, medical insight, and expertise to deploy the right care at the right place at the right time, to deploy the right technology, and not just spend frivolously. So, who can benefit besides those of you that raise their hands and Mrs. Migraine? Everybody. Upstate Concierge Medicine, as the regional leader in telemedicine, can help hospital systems, insurance companies, brokers, and businesses provide this type of care to their patients. So let's get into it. So, value propositions for a health insurer, arguably they have the biggest stake in the game, right? If Mrs. Migraine would have chose the ER because it was too late for her, she certainly has to foot some of the bill, but who's probably paying the bulk of that bill? Probably the health insurer. Imagine if the health insurer could offer their members this convenient option. Hospital systems, large practices. Again, imagine instead of Mrs. Migraine writing a wonderful note to her HR director, imagine if she wrote that note to the CEO of your hospital or your large practice. Imagine if every time Mrs. Migraine thought of, I'm sick or I'm ill, what do I do? She thought of your hospital system or your practice. Imagine if this hospital system or practice could expand its geographical reach without the restraints of brick and mortar. And imagine that they could filter people into their own system. When you need a specialist, you come to us. When you need this, we filter you in through our system to the right care at the right place at the right time. And as we talk about ACOs again, and we talk about bundled payments, capitated payments, and quality care, hospital systems and practices are going to be rewarded for quality care and for cost-efficient care. Nothing does that better than telemedicine. My next slide, I think Mrs. Migraine spoke for herself. If you're a company, you're self-insured, dollar-for-dollar savings. Mrs. Migraine goes to the ER, urgent care, those are your costs. Transitioning your employees to high-deductible plans is another huge, huge factor in this. Okay, Dr. Bibikaus and I, we sit in front of employers every day. Well-intended people who feel bad that they have to transition their employees to high deductibles. They feel bad that they can't afford the premium insurance anymore, and they have to now share cost. But they're going to be responsible for thousands of dollars, potentially, of their own health care. Well, if you're an employer and you're trying to transition your people over, there's nothing better to say, we care about your health. We understand that the finances of healthcare have become a burden, but we're going to give you somebody. We're going to give you an advocate, somebody who can help keep those costs down for the simple and easy things, and then help you use your healthcare dollars wisely by giving you wise counsel and direction. Experience-rated companies are the same thing. You use low-cost utilization services, your rates come down. Other satisfactions, again, happier employees, healthier employees. It's easy. So what makes us different? Why are we going to change healthcare compared to the national companies that are already out there doing this? There's a lot here on this slide, but it really comes down to a guiding principle that started us, which is simple. Do unto others as you would have done unto you. How would you want your family members treated? How do I want to be treated? If you treat patients with a caring, collaborative approach, everything falls into place. What we do is we form a true partnership with organizations that we partner with. When we do that, we can put a trusted face behind the technology. We are regional. We are committed to our patients, to our communities. And when you do that, you can work collaboratively. Our quality, being just the 6th healthcare organization in the entire country to be accredited for security, quality, and accountability, the ATA has recognized us. The national telemedicine companies, Dr. Bibikaus and I were actually 2 of the co-founders of one of them. They're just big businesses now, pushing toward IPOs with little focus on patient care. There's no commitment to the patients. There's no commitment to the region. They have a very limited scope of practice. And because of that, they are unable to work collaboratively within the whole local health environment. And again, the savings is minimal. We can do better, and we are. So as we move forward, just talking some quick numbers, telehealth, many projections out there. One of them says this could be a $38 billion industry by 2018. Market growth rate is between 18 and 30% and soaring. Why? So what's fueling this growth? We hit it right from the start. This growth is fueling because the primary care shortage is massive, and it's growing. The Affordable Care Act has dumped millions of more members into our healthcare system. And again, we're in a healthcare system that has costs that are absolutely unsustainable, and the system will crash without change. So you add that to the consumerism drive that we're all hearing, and it's a setup for telemedicine to be successful when it's done right. Consumers know this. They want this. How come I can click on an app and get a pizza in 15 minutes? But if I got pink eye that my kid brought home, I got to miss work, sit in a waiting room for 2 hours, and pay hundreds of dollars. Does that make any sense? How come I can do my banking online without any cost? We can do better. So we talked back about what it would mean if everyone had this in their pocket. The American Medical Association, which is notoriously conservative, estimates that 15% of ER visits and office visits could be offloaded by telemedicine, and 37% of urgent care visits. That translates into over $300 per visit. Now, if you just took that 15% of ER visits across the country and you put that into a telemedicine platform, you could save over $30 billion. And again, this is just the tip of the iceberg. So rounding it all out, Dr. Bibikaus and I lead a team of local experts with national experience. Our trusted leaders in emergency medicine have been doing emergency medicine and telemedicine for years in this region. So really what we're asking of the region is simple but important. What we're asking is, you already trust us when things are at their worst. Our emergency medicine leaders are the ones that you trust when you're critically ill or injured. So much so that you put your lives in our hands every day. Now we're asking you to trust us with your telemedicine care. Trust us to help transform healthcare in this region through care delivery. And let us be a lighthouse for the rest of the country to see. Thank you very much.
Thank you, Keith. Got a few minutes for Q&A if anyone's got a question.
These guys are awesome. I am a member. Who is not a member, you need to be. Out what these guys were doing. I was knocking on their door to find out how I could help them. You know, it's just a great concept.
Is up with you, or?
So we have different business models, but to take it from the simplest, we have plans to work with practices and insurance companies and health member, or your employer group signs you up when you're sick or injured, like you said. Once you're in that falls into place. If it's a simple phone call to answer your question, then that's all it needs. HIPAA-compliant technology to text pictures or video. Whatever the doctor needs to make the phone call could be as complex as a video conference.
Time for one more.
A personal example. I've got all the symptoms I think was time out of work, sitting in a waiting room, exposure to other oculus. So if I had my symptoms and you make a determination, you need penicillin, you need whatever it is an antibiotic, help.
So it starts with picking the right providers, are trained correctly at their base training through emergency. You have to become a telemedicine expert. So we have protocols, we have guidelines, we have quality assurance, but in its simplest form, it's the same way with telemedicine. If you walked into that room, you get asked a certain number of history. We gather that information. We take all that information, we exercise medical judgment, insight, and expertise. Then we put it together with the patient, and we come up with a medical decision. Or then we do pictures, video, whatever we need to make that determination. And you're under the symptoms, but again, it's that